Good day mga sabas and to my fellow groupmates. I am Hanami Jongay, a student nurse from BSN 1D. And today I am going to assess the eyes, the ears, the nose, the mouth, the throat, as well as the sinuses. And in this physical assessment, it will help the attending physician as well as the nurses to identify any abnormalities presented in the client's physical examination. So now, let's proceed to the actual procedure. The equipment or supplies that we are going to use in assessing the eyes, ears, nose, mouth, throat, as well as the sinuses are a clean gloves, a cotton applicator, a pen light, a tongue depressor, a cotton gauze pad, a notepad and a pen, as well as a face mask. Good morning, ma'am. I am Hanami Jongay. I am a student nurse from Southern Luzon State University. And today I am going to assess, I am here to assess your eyes, your ears, your nose, your mouth, your throat, as well as your sinuses. This will help us, as well as the attending physician, to know if you have any abnormalities and to know what will going to do in order to treat that abnormality. Okay. Wash hands and observe other appropriate infection control procedures. Provide the client privacy. Inspect the eyelids and lashes, width and position of palpebral fissures, ability to close eyelids, direction of eyelids in comparison with eyeballs, color, swelling, lesions, or discharge. So, look up here. Close your eyes. Okay. So, upon inspecting your eyelashes as well as your eyelids, I see that it is in position to your palpebral fissures, and the ability to close the eyelids is in normal state, and the direction of the eyelid is comparison with your eyeballs. So, and the color is normal. There is no any distinctive color that indicates a normal findings, and I don't see any swelling or any lesions in the part of your eyelids and in your lashes. Okay, and there is also no discharge that I saw in your in this area of your eyes. Inspect the positioning of eyeballs, the alignment in sockets, protruding or sunken. Look up here, ma'am. Look at me. Okay, so upon inspecting the positioning of your eyeballs, I see that it is aligned in the socket of your eyes. So there, it indicates a normal finding, so you don't have to worry anything about it, okay? Inspect bulbar conjunctiva and sclera, the clarity, the color, and the texture. Now look here. Okay. This looks good. Okay. So, upon inspecting your bulbar conjunctiva and your sclera, I see that it is clear and there is no discharge, and the color of your bulbar conjunctiva is pinkish. So, that indicates a normal color of our bulbar conjunctiva. So, and the texture is is in normal state. So, we don't have any problem in that. Inspect the palpebral conjunctive. Eversion of upper eyelid is usually performed only with complaints of eyes, pain, or sensation of something in the eye. So now, ma'am, I am going to inspect the palpebral conjunctive of your eyes. And in order to do that, I am going to use a cotton applicator, okay? So now, ma'am, just relax. Okay. Do you feel any pain here? Okay, that's good. Okay. So, upon inspecting the palpebral conjunctive of your eyes, I don't see any
any complaints of pain. Just like what you said, there is no pain in that part of area, and the sensation of something in your eye is not visible. Okay, so it indicates a normal finding, so we don't have a problem in that area. Okay.
Inspect the lacrimal apparatus over the lacrimal glands, the lateral aspects of upper eyelid, and the puncta or the medial aspect of lower eyelid. Observe for swelling, redness, or drainage.
Now look up here. Close your eyes. Do you feel any pain in here? Okay. How about in this part, ma'am? Do you feel any pain? No. Okay, that's good. So, upon inspecting your lacrimal apparatus and your lacrimal glands, and as well as your puncta, I don't see any swelling in that part. And as what you've said, it is not painful, and as well as I don't see any redness, and I don't see any drainage that can cause an abnormal finding. So all in all, in that part is normal, and we don't have any problem that may cause you a more painful feeling in the near future. Okay.
Palpate the lacrimal apparatus, noting drainage from the puncta when palpating the nasal lacrimal duct.
So now look up here, close your eyes. Okay. Do you feel any pain? Okay. So here. And ma'am, upon palpating your lacrimal apparatus, I don't see any drainage in your that comes out in your puncta. When I palpate your nasal lacrimal duct, so it just indicate that it is normal, and we don't have any abnormalities that arises in your lacrimal apparatus. Okay.
Inspect the cornea and lens by shining a light to determine transparency.
So let's now proceed in the next part. Now I am going to inspect the cornea and the lens of your eyes by shining a light to it to see the transparency. But before that, I am going to turn off the lights in order to clearly see your cornea and as well as your lens. Okay? Is it okay to turn off the lights, ma'am? Okay, thank you. Okay. So now, ma'am, just relax your eyes. Okay. Look up here. Okay, next one. Okay. So, ma'am, upon inspecting the cornea and the lens of your eyes, I clearly see that it is transparent. It is you can clearly see your iris as well as your pupils, the dilated, and it is normal. It just shown that your eyes, your cornea and your lens is in normal state. So you don't have to worry anything about it. Okay, ma'am?
Inspect the iris and pupil for shape and color of the iris and the size and shape of the pupil.
So now, ma'am, for the next step, I am going to inspect the iris and the pupils for shape, color, and size. And the size, okay? But first, I am going to turn on again the lights, and to better see or to clearly see the shape, the color, as well as the size of your eyes. Okay, ma'am? Okay, I will just turn on the lights. Okay, so now look up here. So upon inspecting your iris and as well as the pupil of your eyes, as I can see, the shape of your eyes is a round type of eyes, and the color of your pupils is dark brown, and it is so beautiful, beautiful color of eyes. And for the shape and for the size, it is a 5 mm in size, and it is in normal state. When our eyes is in 5 mm size, it is normal. It is considered normal. So there is no problem in your pupil, the size, the color, and the shape of your eyes is all normal.
Test papillary reaction to light using a pen light. Observe the pupil's reactions to light normally. Pupils to constrict.
And now I am going to test the papillary reaction of your eyes to light. So I am going to close the lights again before proceeding to testing your papillary reaction to light. Okay. Okay. So now, ma'am, I am going to sit here, and I am going to test using my pen light. So look up here. Look up. Okay. For the next one. Okay. So, ma'am, upon testing the papillary reaction to light of your eyes, I observed that your pupil reaction is light normally, and the pupil constricted. So it indicates that your pupil is normal, in normal state. Okay, when the pupil is when the pupil constricted, it just indicates that it is normal. Okay.
Test accommodation of pupils using the pen light by shifting gaze from far to near.
So now I am going to proceed in testing the accommodation of your pupils. So now using my pen light, before that, I am going to instruct you on what you are going to do. So I will just sit here. Then you will see, you will look at any object behind me, okay? And I will put my fingers here, and when I am going to move my finger, you will just follow this upon moving, okay? So now, let's see. Look at the object behind me. Okay, let's move from the right, from the left, from the up, down, okay, on the right side. Okay, let's start. Right, left, upward, okay, downward. Okay, ma'am. Upon testing the accommodation of your pupils, it is normal. Okay, I don't see any abnormalities in that area. Your pupils can follow smoothly, and we don't have a problem in that. When your pupil is following my finger smoothly, it just indicates that it is normal. Okay, so I will just turn on the lights. After that, I will document everything that I've gathered or I've assessed in your eyes. Okay. So and after this, I will give this to the attending physicians in order to clearly diagnose everything that I've gathered or I've assessed in your eyes. Okay?
Inspect the auricle, tragus, and lobule for size and shape, position, lesions or discoloration, and discharge.
So now, ma'am, I am going to assess your ears, and the first step that I am going to make is I am going to inspect your both ears. Okay? So now, ma'am, upon inspecting your ears, both ears, I saw that the size is parallel to the shape of your face, and I don't see any lesions or discoloration, because the color of your ears is just same with the color of your body. And it is good sign because it just indicate a normal state, the normal color of your ears. And I also don't see any discharge. It is clean, and I don't see any drainage in that area. So everything upon inspecting is normal. We don't have to worry about it, okay?
Palpate the auricle and mastoid process for tenderness.
So now, ma'am, for the second step, I am going to palpate your auricle as well as your mastoid process to see for any tenderness or swelling. Okay. I will touch your ear. Is it okay, ma'am? Okay. Just relax. Do you feel any pain? Okay, that's good. Okay, let's go to your mastoid process. Do you feel any pain, ma'am? Okay, that's good. Okay. Upon palpating your auricle and the mastoid process, I feel that there is no tenderness and there is no swelling that arising in your mastoid process as well as your auricle. So, which indicates is a normal state, and we don't have any problem in your mastoid process as well as your auricle.
Have the client perform the Valsalva maneuver and observe the center of the tympanic membrane for a flutter. Do not do this procedure on the elder client as it may interfere with equilibrium and cause dizziness.
So now, ma'am, I am going to proceed in making you perform the Valsalva maneuver, okay? So I am going to sit here with you and do this. Okay, let's inhale together. 1, 2, 3, inhale. Exhale. Okay. So upon performing the Valsalva maneuver, and upon observing the center of the tympanic membrane, I don't see any flutter in it. Okay, so you don't feel any dizziness upon doing that? Okay, that's good. So it just indicates that the tympanic upon doing the process of Valsalva maneuver, the center of your tympanic membrane is in normal state, so we don't have any problem in that.
Perform the whisper test by having the client place a finger on the tragus of one ear. Whisper a 2-syllable word 30.4 to 60.9 cm or 1.22 feet behind the client. Repeat on the other ear.
So now we are going to do what we call the whispering challenge. Okay, in this procedure, I am going to perform a whispering challenge. Okay, we're going to do a whispering challenge. I am going to instruct you upon what you are going to do. So when I am whispering in that side, you will cover this side, okay, this part of your ear, so that you will not hear anything from this. Upon whispering in this part, in this area of your ear, and upon whispering, I will ask you if what did I whisper to you, and if you clearly state what I whispered to you, so it just indicate that you have a normal hearing in that part. Okay, so now let's start. I will whisper in that particular area, and you will cover this. Okay, let's start. What did I whisper, ma'am?
Normal.
Okay. And in this part, I will whisper in this part. We'll cover that. What did I whisper?
Blue wave.
Okay. Every words that you said is correct. So it just indicates that you have a good hearing. You don't have any problem in your hearing. So it indicates a normal state in your hearing. Okay.
Document the findings.
So now I will document everything that I've assessed in your ears and I will give this to the attending physicians for further diagnosis, okay? But everything that I've assessed in you so far is all normal. We don't have any problem in that part. Okay?
Inspect and palpate the external nose for color, shape, consistency, tenderness, and patency of airflow.
Okay, ma'am, since we are done with assessing your ears, I am now going to assess your nose. And the first step that I am going to make is I will inspect and palpate the your external nose, or in this part, okay? So just relax, ma'am, and I am going to touch you. Is it okay with you? Okay. Okay, let's do this part. Do you feel any pain in here? Okay, how about this part, ma'am? Okay. So now, upon inspecting and palpating your nose, your external nose, the shape of your nose is in good shape, okay? It is very aligned in your face. It is very parallel in your face, and it's just show a good sign that you have a normal size of nose, and the color is also symmetric in the color of your whole face, or your whole body. And the consistency is really visible in that part of area of your external nose, and I don't see any tenderness, and which is good, because if you have a tenderness in this part, your nose will be this part will be painful, and we don't want to happen. We don't want that to happen. And the patency of airflow. You can breathe well if I am doing that. If I am pinching this part. Yes. Yeah. Okay. So the airflow of your nose upon doing that pinching part is normal. So which indicates that in your external nose is in normal state, so we don't have any problem in that area. So now let's proceed in doing in inspecting the internal nose for the color, for the swelling, or if there is any swelling, or if there is any exudate bleeding, or ulcer, and perforated septum or polyps, okay? And in doing that, I am going to touch this part of your nose. Is it okay with you, ma'am? Okay, I am going to sit here with you, and I am going to use my pen light in doing that. Just wait for a minute. Okay, look in the ceiling, ma'am. Okay, I will just turn it on. Okay. Upon inspecting the internal part of your nose, I see that the color of your internal nose is pinkish, and it just indicates that you have a free flow of blood in that part, which is normal, and it is not a sign of abnormality in the internal of your nose. And I don't see any swelling or any exudate bleeding in that part of your nose, and as well as ulcers. I don't see, or I don't notice any ulcers or perforated septum, or the what we call the polyps. I don't see anything, which is good, because it's just indicate that everything in your external nose, or in the inside of your nose, is all normal. Okay. So upon doing that, I am going to document everything that I've noticed and I inspected or I palpated in your nose, okay? And I will also give this to your attending physician so that he can provide you a more further analysis or diagnosis in your nose, okay? But all in all, your nose is good, your nose is clean, your everything looks normal, so you don't have to worry anything about it, okay? So now, ma'am, I am going to proceed in assessing your mouth. And since the assessment in your nose is all normal, we are going to proceed now in assessing your mouth.
Note any distinctive odors. Inspect and palpate lips, buccal mucosa, gums, and tongue for color variations, like pallor or redness, white patches, a bluish hue, and the moisture, tissue consistency, or lesions, like induration, roughness, vesicles, crusts, plaques, nodules, ulcers, crackings, patches, bleeding, pubic spots, and cancer sores, Stenson and Wharton ducts.
So, for the first step, I am going to inspect and palpate your lips, your buccal mucosa, your gums, as well as your tongue for color variation. Okay, ma'am? I am going to touch you. Is it okay with you? Okay. Okay. Open your mouth, ma'am. Okay. So, upon inspecting and palpating your lips, your buccal mucosa, your gums, as well as your tongue, everything looks normal. The color variation is pinkish. It is indicated that it is normal, and but your lips is a little bit pale. Maybe do you often sleep late at night, ma'am? Okay. So maybe that is indicate that that's why your lips is pale. And for the moisture of your, I don't see any lesions, okay? But the moisture of your lips is a little bit dry, and you have a crack in some part of your lips, which that's the only problem that I see. But all in all, it is good, and you don't have any problem in other part of your lips, okay? Or the buccal mucosa, or the gums, or your tongue, okay?
Inspect gums for hyperplasia and blue-black line.
So now, ma'am, I am going for the next step. I am going to inspect your gums for any if there is any hyperplasia or a blue-black line in your gums. Okay. So in doing that, I am going to use a tongue depressor. Okay. So open your mouth, ma'am. So, ma'am, upon inspecting or upon inspecting your gums, I don't see any hyperplasia or any blue-black line in your gums, which is indicating normal findings. Okay, everything in your gums is healthy. It is reddish or pinkish color. So it just indicates that you have a normal color of your gums, okay?
Inspect teeth for number and shape, especially the color, like white, brown, yellow, and chalky white areas, and also the occlusion.
Now I am going to inspect your teeth for numbers on shape and color and occlusion, okay? And I am going to sit here with you, okay? Now, open your mouth. Okay. Ma'am, upon inspecting your teeth and counting your teeth from upper part to lower part, I counted both part is at 14. In upper part 14, in lower part 14, which is which is normal in your age, and there is no abnormalities in it. And for the shape, your teeth is asymmetric to each other, which is you have some problem in that part. Okay, maybe you could see a dentist in order to align your asymmetric teeth. Okay. And for the color, well, we don't have any problem in the color because it is white and it is clean, it is good. It shows a good condition of your teeth. And all in all, it is good. You just have a little problem in the shape of your teeth, okay?
Inspect and palpate the tongue for color, texture, and consistency like black hairy, white patches, smooth, reddish, or shiny without papillae, and the moisture and size like large or very small.
Okay now mama, let's proceed now to the next step, which is I am going to inspect your tongue. And I'm going to sit here with you. And I am going to touch you again. Is it okay with you, ma'am? And I am going to ask you, is it okay to you if I ask you to stuck your tongue out for me? Okay, now stuck your tongue out. More. Okay, upon inspecting your tongue, I saw that the color of your tongue is okay. It is pinkish, it is not pale, it is not, I don't see any lesions in it or any, the texture is good. And its consistency is so good that it is indicate a normal state of your tongue. And the color is pinkish, and it is shiny. It shows that a shiny part of your tongue without any papillae. And for the moisture, it is moisturized. It is not dry, and it is the size of your tongue is not too large and not too small for and it is just symmetric to the shape of your tongue and to your the shape of your mouth as well as your face. Okay, ma'am? So now I am going to document everything that I've gathered or that I've assessed in your mouth. Okay? And I will also give this to your attending physician so that he or she can give you a further diagnosis in your mouth. Okay? So now we are done with your mouth.
Inspect the throat for color, consistency, torus platinus, and ovula, or what we call the singular.
So now mama, since we are done with assessing your mouth, we are going to proceed now in assessing your throat. The first step that I am going to make is I am going to inspect your throat. The color, the consistency, the torus platinus, and the ovula or the singular. Okay? I am going to use a pen light as well as a tongue depressor. Okay? And I am going to sit here with you. And I am going to touch you again. Is it okay with you, ma'am? Okay, ma'am. Open your mouth. Okay. Okay. Upon inspecting the color, the consistency, the torus platinus, and the ovula, it looks all normal. Your throat is pinkish, and it just shows that you have a free flow of blood in your throat, which is good sign that indicates a normal state of your throat. We don't have any problem in that part. Okay.
Inspect the tonsils for color and consistency. grading scale like 1, 2, 3, or 4.
For the second step, I am going to inspect your tonsils for color and for consistency, okay? And I will grade that to 1, 2, 3, and 4, okay? I am gonna use the tongue depressor and the pen light, okay? I say okay. Okay. Upon inspecting the color of your tonsils, it is reddish and it is so healthy. It shows a healthy tonsils. It is not that super reddish. The reddishness is almost pinkish. Okay, so it is normal. It indicates a normal state of your tonsils, and the consistency is visible, and it is just a sign of a normal state of your throat. Okay, and I will grade that as 3, and because of you also have a good gag reflex. I can see that earlier as we are doing that step. Okay, so now I am going to document everything that I've assessed in your throat. And we are now at the last part of our assessment, ma'am. I'm going to assess your sinus, okay? And for that part, I am going to inspect, or I am going to palpate your sinuses for any tenderness, okay? I am going to touch your face again. Is it okay with you? Okay. Now,
palpate the sinuses for tenderness. Percuss and transluminate the sinuses for air versus fluid or pus.
look up here. Okay. Do you feel any pain in here? Here? I am going to give this also in your attending physicians to give a further analysis or further diagnosis.